Welcome to Value-Based Care Insights, brought to you by Lumina Health Partners, a national healthcare consulting firm focused on improving the strategic, financial, and operational performance of provider organizations. On this program, we will explore trends and share valuable insights on how health systems and medical groups can optimize their performance to meet the demands of this increasingly complex healthcare environment and shift to transform the delivery of care. Value-Based Care Insights is hosted by Daniel Marino, Managing Partner of Lumina Health Partners. Daniel has been in the industry for over 3 decades and specializes in shaping strategic initiatives for organizations in areas such as population health, clinical integration, physician alignment, information technology, and data analytics. For additional insights, visit luminahp.com and sign up for our newsletter. Dan, over to you.
Welcome to Value-Based Care Insights. I'm your host, Daniel Marino. Many hospitals and health systems over the last year and a half, 2 years, have been negotiating with their payers. And interestingly enough, there's been tremendous amount of press over this time period on how the contract negotiations have really been quite the challenge. I think the challenge more so from the healthcare providers than maybe it is from the payers. I've been doing contract negotiations for 20, 25 years, and I have to say, I can't remember a time that it's been more of a tumultuous, challenging situation than it has over this last year and a half to 2 years. It seems like certainly even after COVID, it's gotten much more challenging. And as we start to see these contract negotiations, we find through a lot of the conversations we're having with our providers that they're really at a disadvantage. They feel like it's very difficult for them to kind of build a level playing field, to have a conversation with the payers in such a way that it creates a win-win in their strategy. And a lot of times what we see is the challenge comes in that these payers, or the providers rather, may not necessarily have a strategy on how to frame their negotiations. And it really comes down to 3 things. It comes down to understanding how the organization's fee schedules or reimbursement is measured against the market. Are you getting reimbursed fairly compared to the market? I think second to that is your reimbursement, is your contracting supporting the growth of your organization? So as you're expanding into new clinical service lines, as you're expanding into new surgical services, as you're expanding into an ASC, does your contract and your reimbursement support that growth strategy? And then third, again, there's been a lot of, especially in the last couple of years, a lot of challenges with higher denials around pre-certifications, pre-authorizations, changes of the rules that are unexpected from the payers, a lot of down coding that's occurring and changes in reimbursement associated with that. So again, understanding that is really important as you begin to incorporate that into your negotiations. But again, as you're thinking through that, the advice that we often give to providers and managed care folks is you need to start with understanding where your reimbursement is in accordance with the market. Well, I'm really pleased today to have a great colleague, somebody I've worked together with for a long time, Damon Morse. He's a principal at Lumina Health Partners, extremely knowledgeable on market rate analysis, and has helped numerous organizations begin to answer that question on where they fall in comparison to their market, and then how do they need to begin to position themselves through their negotiations. Damon, welcome to the program.
Well, thank you for having me, Dan. Pleasure to be a part of the show.
So Damon, let's jump right into that. What are you seeing as some of the biggest challenge, I guess, as some of these hospitals, health systems, medical groups are starting to engage in payer contract negotiations?
I think one of the first challenges that I've seen in my experience is that a lot of these small to mid-sized organizations, hospital systems, or the provider groups, that they're not sure where to even start. I think you hit the nail on the head at the beginning. How do we compare to the market as it relates to our current rates and our current contracted fee schedules? A lot of groups that I've worked with just don't even know where to start. So taking a look at current contracts, and what that reimbursement looks like on paper compared to what they're actually getting is maybe a good place to start.
Yeah, I
That's
would agree with
the
you,
initial challenge.
because I'll tell you, every contract negotiation that I've been a part of, and I've had the opportunity of doing this, well, we both have, for numerous organizations across the country, the one response that you can almost 100% bet on is the payer is going to come back and say, you're the highest price provider in the market.
That's exactly right.
Hands down, that's always the case. So it is really important for the provider to kind of get an idea of where they stack up, right? Where their E&Ms come in compared to the market, where do their surgical codes, where are the radiology services, where does it come in the market? So how do you position it around that so they can understand, and answer that question?
Yeah, a lot of groups use Medicare as a benchmark, right? To start some of those conversations and discussions at an executive level. That's historically been a starting place. There are other sets and groups of data that are out there in the market that can help organizations take a look at where they fall relative to a market within a specific geographic area. And that's a place where I would start to take a look at is how the analytics are around their existing contracts relative to a market rate.
Right. And I think for our audience, we've got to be clear on what we're talking about here. So we're really saying or discussing how the average allowables, and you can look at it for a particular plan for that provider, really compares to the commercial plans within that market, right? So you really don't see Aetna compared to Aetna or United compared to United. I think we also have to be very careful that we're not talking about collusion, but there is available data that is out there that really provides some strong insights. So, Damon, in your experience, how are these structured? What does this data set look like?
It's really code by code, CPT code by CPT code. What is a billed amount based on some specific volume, what's an allowed amount, or a reimbursement amount based on specific volumes in a very specific geographic location. If you look at different areas of the country, you and I were here in Illinois, so you look at Cook County or Chicago market, how does a Chicago-based physician group stack up in the Chicagoland marketplace relative to, I don't want to say their peers, but other groups of similar size in that same Chicago-based market basket of healthcare payers? It's not just Medicare, or it's not just Aetna or Cigna. It's a basket of data that's pulled from multiple sources that allows provider groups and hospital systems to rank themselves relative to a market. And it's broken down into, if we all remember statistics, right? Like the old bell curve, where you are in the 10th percentile, 25th, 50th, 75th, and the 90th. Where does your fee schedule rank in relation to a market in the Chicagoland area, or it could be anywhere across the country?
And this is different than transparency data, correct?
That's exactly right. Transparency data is self-reported, right, by a hospital system or provider group. I think hospital systems have done a fair job. I don't know if I would say good, but they've done a fair job required to report the data and being transparent with what the cost structure looks like from a hospital system. But from a provider standpoint, I think there's not a lot of, I have not seen in my experience good data sets that have some relatively good transparency around geographics or specific to a marketplace. And it usually would be that maybe one large player in a market is driving the market if there's transparency data that's available.
Right. I would agree with you. I think the transparency data has been a little bit limited. I think it is another data point, but what we're talking about is really the claims data that would occur, that would be aggregated for the commercial plans in the particular market. So when a hospital or a medical group or an organization is thinking about moving forward with this, what's some of the objectives of going through this market analysis? Why would they want to do it?
It's initially from an understanding point of view, depending on who they're reporting up to and where the questions are coming from. And at an executive level, groups would want to report to a board of directors how they stack up against other organizations in the marketplace, right? So it's educating the audience who's asking the question. It may be from physicians if they're employed or if they're independent within a specific organization, the physicians may be asking, are we reimbursed appropriately or adequately? So it starts the discussion internally among executives and educating the team or the players. Where do we fall, right? It starts the conversation around, and it's initially about educating the audience out there.
Well, and I can remember going back a few years, you and I worked on a great engagement, and there was a large faculty plan that had a number of employed physicians, and that's exactly the question that they wanted to have answered, right? So the faculty and the department chairs were coming up to the health system leaders and saying, okay, how does our reimbursement through the practice plan compared to the market, and how would it look if we were on our own? So that analysis, I think, is great to be able to provide that insight.
Yeah, exactly. And I think some of those physicians that may sit in those leadership positions, if they're still practicing clinicians, they may be reimbursed at some level of productivity, right? So they may be asking from two perspectives. One is the organization being reimbursed appropriately, but two,
right,
as a physician employed within this practice and this model, am I compensated at a market level? Am I being paid individually or within a specific specialty for a practice plan? Am I reimbursed individually within the range? And I think both of those things are important when you take a look at some of this market analysis.
Well, that's an important point, because a lot of the academics are moving to a revenue allocation of net revenue per RVU fee to be able to fund some of the departments. But how about for organizations who are starting to move into their contract negotiations? How would they use this intelligence, this insights coming out of this analysis to support their negotiations?
And it's payer by payer specific. I think most of your audience may be familiar with the larger players and the smaller players from a healthcare, a health plan perspective, but taking and putting together a methodology around or an approach behind how you're approaching that new negotiation that's coming up, right? So if you want to take a look at and interpret for one specific payer how you're stacked and ranked, but putting together a strategy really behind that one specific payer, or it may be that they have these upcoming discussions at a board level on an annual basis or a biannual basis. But if they don't have those things in place, I think putting together a plan or a strategy to talk about, first to educate an executive team on what's happening and how they rank. But once that's done, taking a look at and determining how frequently should we look at this information. Is this a once a year look? Is it a couple times every few years? But I think it's really looking at a strategy or an approach behind a specific payer. If you've recognized that you're below a market percentage within one of your health plans, you need to come up with a strategy, or you should develop a strategy around how do we bring that up? What do we need to do? Is it within certain departments that we're short, or in other areas that we're strong, and coming up with a strategy as an organization around that conversation with a payer.
If you're just tuning in, I'm Daniel Marino, and you're listening to Value-Based Care Insights. I'm here today talking with Damon Morse, and we're having a great discussion around market rate analysis as a vehicle to support contract negotiations. So Damon, just kind of building off of that, it really does help you level the playing field to a certain extent, especially if you identify that a particular either plan or some elements within the reimbursement, say surgeries or radiology, if you will, if it's way below the market, you kind of understand what you're asking for, right? And then I would think on top of that, begin to understand what levers you can push or pull to get to where you need to come in as an organization compared to the market.
And I think back to a point that you made earlier, a lot of players may not know where they fall relative to a health plan. Are they above or below? A health plan always is going to say you're the highest paid, right?
Yeah.
This data and the analysis can help with that leverage to show, look, we're not the highest paid. We might be the lowest or the second lowest, or we're, if you have provider groups that are in the 75th and the 90th percentile of reimbursements, and our group falls in the 25th to the 30th, we know we're well below the market, right? So I think it helps from a leverage standpoint in some of those contract negotiations where you can produce data and outcomes and results that have real information behind them and it's not just pie in the sky, but it allows you to give some good leverage behind what's
Right.
happening in the marketplace.
Well, and that's so important because you certainly don't want to be the highest paid provider in the market, right? Because at the end of the day, the payers are contracting with the employers, and the employers are really going to pay for this, right? So if you're making a push and you're fortunate to get, say, the rates at the 90th or 95th percentile of the market, that potentially is going to make your employers and the employees pretty upset, right? Because that means the overall cost of care is going to go up. So I think it's important to understand what the right ask is, where you should come in at the market, and then in particular, how does that support the economics of your cost models of the organization and frankly your margin of where you want to come in. When you've done this in the past, what are some key things that you look at related to, let's say, surgeries or the medical versus the surgical specialties or even E&Ms? Does everything need to be paid at the same rate, or do you often see that you have different levels or different reimbursement structures given where you are in the market and maybe even your volume?
I think that's a great question. I think some of that depends on how your contracts are structured. Some contracts may be a flat percentage across the board for the whole contract. And in that case, different categories of CPT codes, surgical codes, or your E&M codes, path lab, radiology, they're not all going to be the same, right? I think the group on the phone or your audience is probably aware of the Medicare adjustment to the fee schedules a few years ago. So if everybody's contracts are based off of Medicare fee schedule, your E&M codes might be low where your surgical codes might be high, right? So I think in our history or experience, we've seen some of that, but that then helps with the strategy around or the discussions about what do we do with that contract if one area is low and one's heavy. That then could be part of the strategy around a negotiation.
Yeah, I agree with you. And the other thing it allows you to do too is to make sure that you're getting reimbursed appropriately, because you're asking for the allowable amount, and then we always ask for the payment amount. And although this isn't a revenue cycle assessment, it is important to kind of evaluate how well you're getting reimbursed against the allowable amount. And I'll tell you, this is where denials are coming into place. Over the last couple of years, we do a lot of revenue cycle work, as our audience knows. We've definitely have seen denials go up, mostly because of pre-authorization, for downcoding, for all sorts of related issues. And this is where you identify it. You build that right into your contract negotiations.
That's exactly right. It's an easy way to look at denials and authorizations and what's really happening with the claims that are going out the door and what you expect to come back and the reality of what's actually coming back, right? From a payment standpoint or a denial standpoint.
Yeah. How do we take into consideration shifts in site of service? So, there's been a lot of some services which are more hospital based and that now have shifted to ambulatory based. When you've looked at this rate analysis before, I'm assuming you look at the professional side as well as the facility side. How does the shifts in site of service come into play?
It depends on the organization and if they have different locations or sites of service where they can provide the services. We look at both sides, the professional side and the facility side. And as you just mentioned, the payers are pushing more towards an outpatient or an ASC type model because the fee schedules are typically lower. And you take a look at, from a strategy standpoint, potentially with one of your clients to figure out where is it best that we perform certain services. They may be performing them in a hospital setting today on an outpatient basis, but if they move those services to an ASC or even to a standing clinic, will they be reimbursed at a higher level, or can they negotiate or leverage those contracts in those locations to benefit them as an organization, moving it into different locations? So we definitely take a look at site of service. It has a huge impact.
Well, it has a huge impact. And I'm so glad that you brought that up. It reminds me of a conversation and some work that we had done couple of years back with an organization, and they were doing their planning for their ASC, and it was a joint venture. The cost structure obviously was much lower than it was in the hospital, but although they had some general ideas on what they thought they were going to get reimbursed, when they actually started a lot of the work in the ASC, it actually came in about 30% below what they thought they were going to get reimbursed. And going back to their contract didn't reflect as appropriately as it should that transition from the inpatient to the outpatient, and the payer just set them up on a general fee schedule. So really being able to kind of understand how your reimbursement and the negotiations need to support your strategy, almost thinking in advance, like 2 to 3 to 5 years, right? Becomes really key. And then through this, you can model it.
That's exactly right. Thinking through where we are today and where do we want to go tomorrow. And some of these discussions with the large health plans, if you have a large client and a large academic medical center, a large medical center in one of these larger geographic areas, those conversations and those negotiations, they do take years, right? And to get your payer reimbursement, your provider reimbursement back to where you want it to be, it could take 2-3 years of a negotiation just to get an organization there. But in that discussion, taking a look at where you provide services today versus where's the most advantageous going to be in that 3 to 5 year period, it's really important to have at an executive level, especially if you're building out new lines of business and new service lines within your organization.
Well, and if you haven't, if a hospital or a medical group hasn't negotiated their rates in, 5, 6, 10 years, and believe me, there's a number of them out there that haven't.
We've seen that recently, right?
Yeah, we've seen that recently.
You open the books and you look at the fee schedule, and it's a derivative of something from 2018 or 2020
or 2015, for that matter.
It's
right.
time to look at a strategy.
Yeah, and you can't ask for that 20 or 25% jump in year one. You're not going to get it, right? The payer is going to, just sit back and laugh at you. But so through this, I guess it does help you understand what is the appropriate ask and what's the appropriate escalation, right? As you enter into the first year, and hopefully you're negotiating a 3-year contract, because you certainly don't want to go through this year in and year out, but it helps you to understand what you're asking for in year 2 and year 3 and beyond.
And it's interesting you say it that way, because if I think from an employee standpoint, right, we've all been employees of organizations. If you go into your employer and you think that you're woefully underpaid and you ask for a 20% pay increase to come up to market rates, they're going to laugh at you, right? Yeah. But if you can come in at 3 to 5% a year over the next handful of years, so that then you can become, in the ballpark, that it's this exact same concept as the health plans, right? Because they also, on the other side, have to fix their reimbursements and their methodology that they're having with their employer groups who are funding all of this. So
yeah, no, that's absolutely true. So for our listeners, if they're interested in doing doing a market rate analysis or learning a little bit more, what's some of the pieces of advice you might offer some of our listeners on where to start?
Starting points would really be to sit with the group who is doing at an executive level some of the reporting around or the discussions around their contracts, and have them take a look at, and maybe, to what we just said, blow the dust off of some of their group's contracts to see what years are those agreements in. Are they old? Are they new? Are they recent? But that would really be a starting point to see how old some of their agreements are that they have in place, and are they just evergreen? Have they been rolling for the last handful of years and nobody's really taking a look at them? That would be a good starting point.
Yeah, I would agree. I think the other piece too is it is an investment, right? So organizations have to be prepared to make the investment. I wouldn't say it's a whole bunch. It's not a large investment. It's not a whole bunch of money to do this, but it is something that I think certainly has a clear ROI, but you have to be prepared to make the investment and really use this as a tool as you're beginning to think about your negotiations and your financial modeling as well.
That's right. I think, to your point, a small upfront investment can reap the rewards of a 5, 6, 7% increase, and depending on the volume and the contracts that you have, it will pay for itself, hands down, in the first month of the updated and new billings that you're going to get out of an organization. The investment is well worth what you're going to get out of the data, even if you just start at a board level and an executive level from a conversation standpoint. Educating the group will pay dividends as well, so that your team is much more educated about what you're doing. But absolutely, it's an investment financially, but it pays dividends.
Well, I tell you, this is something that I believe is really valuable. We've done this numerous times with other organizations as we've supported their payer strategy and their negotiations. And like we talked about, if anything, it does help to create a level playing field. And in this day and age, it's hard to create that or to have that as you start to negotiate with your payers. Well, Damon, I want to thank you for coming on today. This is a great discussion. I'm sure we'll talk about it a little bit more, but really appreciate your time and sharing your insights.
Well, thank you for having me. Glad to be a part of the conversation. If there's any additional questions that you could have of me, Dan, just let me know. Happy to help.
Yeah, we'll do. And we'll put your information out there so some of our listeners with you directly. And for more information on this topic and others, please visit luminahp.com. And I want to thank everyone for listening today. Until our next insight, I'm Daniel Marino, bringing you 30 minutes of value to your day. Take care.
Are you at a crossroad with value-based care? Do you need to chart a future strategy or improve your organizational performance? Visit us at luminahp.com to learn more about our consulting services and leadership development programs. Also, you can sign up for our newsletter on our website and follow us on Twitter and LinkedIn. For more information about value-based care insights, visit the programs page on healthcareradionow.com or luminahp.com. Join the conversation using our hashtag VBC Insights. We are Lumina Health Partners. Thank you for joining us today. Until the next value-based care insight, stay well.